you hear me? Can Okay, wonderful. Okay, let me just, hi everyone. Happy Wednesday. Let me just add Rowena in. Yay, okay, great. Rowena, do you get my invite?
Yay!
Hi.
Hello. Okay, let's just wait a few minutes and then
Sure.
see who's joining us, yeah? Great. Okay, yay! This filter is so cute. We want to be always getting love. Yeah, okay,
Yeah,
let's
that's
wait for
what
a minute and then we can start.
Yeah.
Yay, so how are you today?
I'm good. You?
I did a tea rebalancing session for Rowena yesterday, just to give her a try. She's my new partner. We're sharing a clinic together down in City Hub. So, we were just chatting about COVID, about vaccines, about shedding, about eczema and all that kind of thing. And, we realized that we have so much in common. And we were actually, surprised that we discussed about COVID, that there is such a big similarity among those people who have COVID that, some of them really have very, very severe side effects. And they can actually be very, very fit before, but somehow after COVID, the fitness is down the drain and, they can't even breathe for some of them. But, I think this is not something that's just because of COVID. They might be having inflammation from before maybe. And then I was asking Rowena, who is a spine specialist, about, whether there's, what does she see so far in some of her clients, whether the COVID effects actually affect the spine, and talking, somehow we decided, hey, let's have a chat online and then we'll share this information that we chatted about with everyone.
Share a lot, right?
So much to share. So anyway, a little bit about myself. If you don't know me before, for those who are joining from Rowena's side, okay, my name is Sylvia. I'm a Meridian therapy practitioner. So I help people do tea balancing, and I also conduct workshops for both corporate as well as for, public on how to, self-heal using Meridian therapy. So me and Rowena were talking, and then we found a place, and then we are, sharing the same clinic together now. So Rowena is the founder of Real Ease. She actually tracks trauma on your spine. Okay, I'll leave Rowena to introduce herself. It sounds very focused, but I tell you, I swear I've tried it, it works. Okay, Rowena, please tell them all about what you do.
Hi everyone, my name is Rowena Chu, and I'm a spinal flow practitioner. Basically, what I do is I rebalance the nervous system. So usually, what we don't are probably not aware of is that a lot of us have blockages on the spine, and this causes information flow from the brain. Disruption from information flow from the brain through the spinal cord to the organs and the endocrine system and everywhere in your body. So when there's an imbalance, your body don't function optimally. That means you cannot self-regulate or self-heal, and the communication between your brain and the rest of your body is a little bit haywire. Yeah. And what I do is just gently touch what we call an access point, where there is dura mater, which is the same thing that's it's the third layer of the brain, and we have 33 points in the body that we usually work with, usually at the neck area and the sacrum area. And I will feel for the access point that is the most open. That means it feels really good. There's a lot of life force and energy there. I gently touch it, and that kind of just helps the body remember what your body, the rest of your body should feel like, and just press it, and that helps rebalance your nervous system. And you feel more relaxed. You feel your breath will be, deeper, your better oxygenation of your cells through your body, in your bloodstream, lowers inflammation, pain relief, and a lot of other things. Yeah.
So how do you know actually what point to look for? I mean, you just said there's 30 over points, and this is all along the spine, yeah?
Yeah, so mostly in the neck area and the sacrum area, which is just behind your pelvis area, the middle of your pelvis area, the bone that's in the middle at your back. But there's also some around the head area. And
Oh,
so it's almost like more intuitive when I feel it, I could feel which one feels more open, and then I'll go to that point and work on that area. Just gently touch it. No manipulation of the spine.
yeah. So when people hear that, oh, your spine track energy from COVID or trauma from something that might have happened to you in life, or you know, even stress for that matter, what manifests in the body actually?
Well,
like what do you see as a practitioner? What are some of the signs and symptoms that we should look out for?
So usually for me, I feel the spine. So I will feel, I will look, and I will ask my client. So part of the assessment is doing simple movements like, turning the head, or, doing certain simple movements. Yeah. So just by doing this, for example,
draw the
let me skate the figure 8. This is actually very helpful to release tension in this area, C1, C2 area of the spine.
Oh, okay.
Yes.
So I also thought that if you do that, it wears out your spine joint. Is it true?
No, I don't. So if there are some people who like to crack their neck, like
yes.
Actually that's really not ideal, because if you go to someone who actually know how to do that, trained to do that, they know exactly which vertebra to crack or to align, right? But when you do this, sometimes you may kind of accidentally or inadvertently move something else, which is the one below or above it. It does feel better, but over time you need to do it more in order for you to feel that effect.
Okay.
Yeah, which is actually over time is more harmful. If possible,
if you actually achieve what you do without manipulation at all.
Well, I mean, okay, our body know what to do all the time. When we fall down, we have a cut, right? And what we do is we support the body to heal. Yeah, we clean the wound, we put on a band-aid or handy-plus, if we need to, like antiseptic cream. That's what we do to support the healing. But after that, your body would know what to do. It will coagulate the blood. So if you stop bleeding, it dries up, and then it will slowly heal. If it's not deep, you don't even need stitches or whatever to kind of get it to heal, right? And the body does it. You don't take a pill for it to kind of like Wolverine and heal immediately, right? The body just knows what to do, right? And it does it over time. Yeah.
So it's just a fast or slow process. So I guess for you make it faster just by reminding the spine what to do.
Yes. Because a lot of the times when we are under chronic stress, the body is not in a good state to heal, to digest. Even for reproduction, sometimes people have fertility issues or even reproductive system issues like menstrual pain and all that kind of thing. It is because of blockages in the spine.
Oh wow, okay. Even for infertility.
Yes.
Wow, okay. So by seeing you'll be able to tell them where is the problem.
Yes.
So okay, I think we've gone a bit too far. Okay, back to this COVID again. What are some of the signs and symptoms you have seen?
So very common one and usually very obvious one is usually pain, some of them pain, stiff neck, and like in the neck area, there's usually like a hump. It's kind
I know
of
what you're talking about. I saw the hump today. I was teaching somebody who just recovered from COVID, and she has this massive hump on the back where the 大椎穴 is, the point that connects the frame to the head. Yeah, and she has this lump right on the neck. And, I can tell that it was actually affecting her chi a lot. And, it was even bouncy. So it hasn't hardened, but it's like bouncy, this lump is just like, so I couldn't get it out of my mind. It's the first time I see a lump like that. Because usually it's formed over time. Well, in Qigong we call it 富贵包. So usually this 富贵包 is formed over time. But I think hers is newly made. Like literally newly made when she got COVID.
Yeah, it's pretty common, especially nowadays. It's just so common to see that. In the past, it's not. I mean, I don't see that as often, and the way it looks is different. The feel is also different. So there are different causes of that. Sometimes it is because of hormonal imbalance. Sometimes it's because of certain chemicals that's causing that. Yeah. But nowadays it's just different.
So besides the lump, what else have you seen?
So
like
you
eczema
mentioned like
that.
breathlessness. Yeah. In this area, there's more blockage,
Yeah.
right? In the chest area, which is the thoracic spine, which we call the center gateway. And then the lower back, lumbar spine. So sometimes it manifests as pain, sometimes digestive issues, even like eczema and psoriasis. Yeah, fatigue.
And all this eczema, psoriasis, you reckon is actually because of the trauma trapped in the spine?
Yeah, so I mean, it definitely, because when there is a blockage, so when I refer to the lumbar spine, so when it's affect this area, then there's a blockage in this area, right? So then, like I mentioned earlier, there's some nerve, the nerve that connects to your brain and to whatever organs like your intestines and your reproductive organs. It's information flow is not optimal. So sometimes information flow from the brain, to the organs may be disrupted, and vice versa, right? So when that happens, of course, the other thing is that inflammation could then also cause issue, right? And a lot of this is actually an issue with inflammation, low-level chronic inflammation. Yeah, it's not usually when you see in the past inflammation, it's quite easy to see. I mean, if it's kind of physical related, you see redness, you see heat, you feel heat, right? But nowadays, all this you can't really see, but it manifests as, eczema, digestive issues, ears ringing.
That's actually a very interesting point that you brought up.
Yeah.
Somebody that I saw today that just recovered from COVID also was having really bad digestion issue. She was having pain all over. Like one day it will be here, the other day is somewhere else, and then the next day it will be like at the back. So this pain is like just running all over in her body. And for me, when I did the treatment on her, I diagnosed it as wind, right? And essentially in PCM, COVID is kind of like a wind heat evolve. Okay. But I also see that some of her spine has actually popped up. Okay. And there's a lot of tension. And I remember what you said about not being able to walk in a straight line with your eyes closed, heel to toe. And I also remember what you said about the tailbone being tucked under because of her condition, right? Because of her fight or flight mode. I see this in her entire spine today. Yeah. And I think, it might be one of the side effects that, this COVID trauma has on the body. Yeah.
Yeah, so
what would you recommend, like, for like what to do to test whether you have this trauma?
To test whether,
like what you taught me that day, like just put up the hand and close the eyes and then do the walk.
Yeah, so that's one what that can be a bit difficult when you're alone. You may feel like so usually when I do that, I will stand next to my client and just in case, just to be there. Yeah, just to be there. Yeah. But
how many steps are they supposed to walk?
Let me share another one. So let me share another one.
On my boyfriend, he walks
most people have difficulty walking more than 2 or 3 steps without wobbly, feeling wobbly. Yeah. That really just means that your body is in fight or flight and has been in that state could have been in that state for quite some time as well, depending on how, because some can't even take the first step, right? Anyway,
yeah, correct. They can't even put the leg in front of the other, Yeah, you're absolutely right. Yeah.
Yeah. So, but of course, some of these different people have different issues. Sometimes there could be coordination or vestibular issues. So this one may not be 100% correct because I will usually do different, another test to also do that. So one thing that actually people can do to check their state, whether they are in a calm state, rest, digest, heal state, or a sympathetic state, which is fight-flight state, is count the number of breaths you take within a minute, 60 seconds.
Okay.
So you time it, and then you count how many.
And usually, this is at rest.
Yeah, that means you're not moving around. I mean, usually you wouldn't be but even if you're I wouldn't expect you to kind of like be working out when you're doing that because it's different, right? So So try that out. But do you want to know how many you should take? I mean, how many is the standard?
I'm trying to count how many I take in 20 minutes, which is about 20 seconds, which is about 5. I suppose you just take like 20 seconds and then you just
Actually, that's actually quite a lot.
I think like that, right? Oh, yeah. So I think I'm like constantly breathing, right? If I'm like talking, I probably like stop breathing or something, I don't know. What if I'm very conscious when you tell them that?
So usually when you're in a rest you digest state, you would take around 8 breaths in 1 minute.
In 1 minute, okay.
Yes.
Okay. I'm doing this the next time I see you, okay? Sure. I say it because I'm just like, okay, I should actually breathe normally or should I try to maximize my breath? Or?
You should breathe normally, but so it's best if you're not looking at the clock ticking. So if you can get someone else to just check the clock for you, set the timer.
Okay, that helps.
It's more accurate that way.
Yeah, because in 30 seconds I have already like taken 5 breaths. So it's like, oh no.
Because you're counting.
Because I'm counting, so I'm like,
yeah.
Yeah, but I think that's a very good gauge for some of those people who might be tuning in, whether to this or to the recording later, Yeah. One of the common symptoms I've seen in people who have inflammation right after COVID and a T blockage, as we call it in meridian therapy or TCM, is that they have an insomnia problem. And the insomnia problem is actually quite serious. I had a client who came to me and he had insomnia for almost 2 months right after his COVID. He just couldn't sleep at night and he had to pop a pill.
Right.
And right after we actually balanced out the T for him, he could actually sleep, and then he said that actually it works even better than the sleeping pill because the next morning he could wake up. Yeah, so that is the T rebalancing. Yeah. So we actually rebalance the T of the 12 meridian channels, and we make sure that there's no blockages. Yeah, so very similar, except
very,
I work with software, you work with hardware, Right, you are working in the spine, there's the hardware, right? So after they see me, they see you. After they see you, they can see me. Perfect.
Well, I mean, the thing is, in spinal flow, we do that as well. So the chi will automatically be rebalanced as well. Because every time what we look for is the spinal wave. And what that means is really the life force going through the spine. And sometimes we will also, so we don't go to the specific area where there is a blockage, but we work on areas that's working well. And then we try to get that chi flowing. So when this area is, like you say, this is the brain, this is your head and this is your heart, right? And when this area is stopped, then it's the same thing in spinal flow as well. Yeah.
Okay, great. I think we gave the audience a lot to think about today. So for those of you who are interested to find out more about this, whether it's spinal flow or T rebalancing or meridian therapy, we're actually having a workshop at the Polo Club next Saturday. It's an afternoon tea session, so feel free to ask any one of us for the details. And then also, if you want to come see Rowena or myself, feel free to DM us or leave us a message, and then we can come back with more details, okay? Our clinic is at TT Hub. Is it 1 or 2?
One. No, 2. Yes.
Yeah, just 1, yeah. And just buzz us and find out more, and feel free to ask us any questions in the comments below, okay? Okay, great. Share the video with your friends if any one of them is feeling the side effects of COVID. Okay, we really can help them. Let's give them hope. And we empower them that, post-COVID is not the end. If they have symptoms, it's not the end. Yeah? Okay, thanks, Rowena, for sharing. Thank you, everyone. Bye.
Thank you for having me. Bye.